All right, welcome back, everyone. I hope you had a good break and got your requisite coffee, caffeinated beverage, and of course, awesome sweet treat, cookie, or pastry item. So my name's Hillary Nixon. I'm Deputy Executive Director at the Minnesota Transportation Institute, and I am excited about this afternoon's session 4, final session of the day before the banquet this evening. Let's see if we can keep that energy and enthusiasm going from the last session, which I really enjoyed. So session 4 focuses on looking at what are the long-term impacts that we are going to see as a result of the COVID-19 pandemic. And I think I'm going to model moderating this session exactly on the approach Yinhai took. So we'll have each one of the speakers give their presentation, then we'll open up for an interactive discussion. So our first speaker today is Dr. Rongfang Rachel Liu, who is Director of the Transportation Institute and UPS Endowed Professor at North Carolina Agricultural and Technical State University's Willie A. Deese College of Business and Economics. She has extensive experience in the area of intermodal transportation planning and engineering, environmental impact and major investment studies, and travel demand forecasting and simulation modeling. Rachel.
Thank you very much. I know about maybe a quarter or a third of people in the room say, what, when, how? I know many of you knew me as a transportation engineer professor from NJIT. Pat said he's been coming here for 20 years. That's how long I've been in New Jersey. But I just made the move last year. My husband been joking, said, well, since we're confined to travel, but you're a transportation planner, engineer, you have to travel now, right? Yes, so we turned out like snails. We can't travel alone, but we carry our houses around. So we moved to North Carolina. All right, so that's where we're going to get back to my topic, which basically is a critical roles theme, which you probably already know, shared, electric, automated mobility during and post-pandemic. I think you probably don't need me to tell you what during, you all probably went through that, but I'm trying to, shake my crystal ball a little bit about the future post-pandemic. So just a general, quick overview. I'm going to a little bit highlight during the pandemic, what happened to transportation, especially transit and various transportation mode. Then we're going to do a little bit prediction about the theme. And most likely we wanted to say, besides the different modes and service sort of providers, what is a long-term impact from, I know some of you know I have been doing travel behavior analysis, intermodal, multimodal transportation planning, and what are the overall impact? And of course, then we'll probably try to highlight my topic, what's the critical role of theme? And this is where, again, we go through sort of the mode, the vehicular, transit, and various shared mobility or electric vehicles. And with that, I think we all have personal experiences, but this probably put in perspective some statistics or what you call meta-analysis. I don't know how well you can see. This is pretty much, I pick up a few different spots. If you look at on the left, the bar is Spain. In the middle is US. And on the total right, of course, China. Again, this is look like a bar, look like the data, but you probably know this is really just a spot check. We took Spain as representation of Europe. And you probably remember that's the very first country when they get a severe impact by, COVID. And US, really, I'm taking just New York City. What is the impact when the pandemic hit the city very bad right in the end of March 2020 or beginning April? And of course, in China, that's really extreme. This information taken from Wuhan when this whole city was shut down. So this is sort of a spot tell you what is the overall impact oh, what is the extreme we can get into? Of course, it's not just vehicular. And now, if you look at the transit use, and especially in New York City, that's what I call decimated. And you look at their overall, this is actually different mode, subway, bus, and the Metro North, which is commuter railroad, and Long Island and Pass. This is show you where the ridership dropped for end of March. One of my former PhD students worked in the MTA sort of capital and ridership forecast department. This is the data that collected right away, again, toward end of March, beginning April. Guess where the bright spot is, right? Everything dropped, the vehicular, the transit, only thing increases, or you see still running and more people is really bike. The New York City see almost 70% increase. And when you look at Lisbon, this is Portugal. Similarly, in other places, the third bar shows UK. As you can see, this is where I think for transportation planners, travel behavior analysts or specialists, you can see this is very unique opportunity to really look at what is the impact across the globe. Because as you may know, when we used to transit research, we used to say, well, that's Indian data. That doesn't apply to Western world. Or Chinese have a very different transit use, all right? But the pandemic impact, there's no boundaries. You can almost see this is pretty dramatic. Doesn't matter, is it Western, developing country, or what is the geographic location. And air traffic. This is where maybe you don't really know what the numbers, but if you have a overall examination, you maybe know, oh, the airline doesn't fly anymore. The more severe impact actually coming from other, some sort of follow through actually done, just wrapped up a study for US DOT. They have a AMJP program. Once your, airline travel, airline industry getting grounded or, less fly, the manufacturer, the repair stations getting even more devastated. And of course, you probably see most of us, I would say, in passenger travel. Similarly, freight has a very much parallel sort of impact, but you also see some other unique characteristics. You probably know the freight, especially logistics, in the beginning or throughout the pandemic, the demand actually increases. And same time, you actually see a lot of things we took for granted. We're actually thinking the rail industry is sunsetting. Nobody care about railroad, but suddenly we see, oh, gee, we can actually use the rail transportation, the intermodal freight really get picked up. Even now, we'll probably talk a lot of supply chain issues. And when we have the freeliners or port cannot keep up with the demand, where do we go to? Now we're really looking into the intermodal transportation system. Another thing, I think we're not really too much experience or didn't really think that's a viable mode. It actually pretty prevalent in Asia, in Middle East. I just came back from Israel for 2 weeks, actually just returned last week. You actually see a lot of delivery use bikes, motorbikes. This is where you actually looking at whether it's innovation or alternative, be creative so you can have the last mile, all the goods or needs get delivered. And of course, other good news, I guess you probably already guess if we don't travel that much, You probably don't have too much pollution, accident. You know, we have quite a few issues actually. Sessions presentation today talk about safety. When you have the mileage going down or you have less people travel, generally your accident numbers will reduce. However, not always, right? I think I heard earlier, especially in rural community. And I actually done research, this is about 10, 11 years ago for PCRP. We actually compare the transportation or fatality across different mode. One very particular characteristic is in the rural area, especially we'll have 2-lane highways because the speed is such, because you don't really have, like, you know, David talked about turn lanes or really any other room. Generally, the fatality is high. So in the beginning of the pandemic, we actually see, you know, from the accident perspective, generally, yes, it's been reducing because we have less travel. But if you look at particular case studies, we actually discovered the fatality rate actually increased because, hey, if you assume not too many people on the road, maybe I can literally just drive 60 miles per hour, even on the urban street. When you get into collision, it will result, you know, fatality. And this couple chart is actually show the pollution, sort of oxygen, nitrogen. So this is, again, is probably expected what it is. But what I would like to come back is, what is the behavior change after the pandemic? Oh, we see a lot of sort of different behavior during the pandemic. Are we going to keep all of this? Or is going to change, or the old behavior come back? The good thing is you probably look at some of the things are coming back quickly. As we're saying, a lot of us have a memory of goldfish. We just remember, you know, 30 seconds ago, then totally forget. A good thing for transit planners, this is a photo I took in Jerusalem. You probably know in Israel, people all took 4 shots, everybody. The infection rate was very high. The estimate was about 70% people already got infected, but everybody took the shot. That's pretty much across the board. So if you board the light rail, and anywhere you go to, you know, the Western Wall, and you don't see any pandemic trace, except, of course, when we come back, we have to do testing. It's like, oh, we're still in pandemic. And so you're looking at the transit use. We're pretty much, you know, in particular areas, because a lot of times we're looking at the captive or choice riders. If you have a choice, maybe you don't need to use the transit. However, if you are, you know, the blue collar worker or inner city worker, you don't have any other alternatives. And currently, if the gas price is so high, maybe just too expensive for some people to drive. So that's where we see the transit use actually pick up pretty quickly. And vehicular traffic, yes, you actually see still not back to 2019 levels in most locations, largely because, hey, we're so used to work from home, right? A lot of, you know, white collar workers, they're told you can only, you know, you only need to commute 1 or 2 days each week. You can still, you know, do telecommute, or others, especially in New York City. The office space is so expensive. Some of the offices say, well, we actually get rid of our lease. You can just work from home permanently. Actually, that's part of the reason I moved to North Carolina. My husband's company said, well, you don't have to worry about come back to the office anymore. We have telecommute. So like, hey, we're free to go wherever I need to go. So this is where you see a lot of trends where in general, the transit or, you know, vehicular, and if you look at the airline traffic, we have not got back to pre-pandemic level yet. And from the shared mobility, what I like to emphasize is people when hear shared, you probably think about Uber, Lyft, not necessarily all that, right? So I think all of you probably realize when I show the chart, bike share, again, a lot of new technology, the dockless or city bike, you see great sort of increase, and seems like that trend is going to stay because in New York City, initially when they start this membership, like $99, you can have a year at a big batch sign up, then it just taper off after a couple of years. And during when the pandemic started, they see a big jump. And now they don't see dropping. This number still increase. And of course, the city trying to work out how you actually create a sort of app is easier for tourists or people temporarily use those shared mode or active transportation. And electric vehicle, I guess I don't need to preaching here. With the gas price so high, with the national policy, I think if some of you watched the news closely 2 days ago, Biden just had this, $7.5 billion will install about 500,000 charging stations. So this is a national push, sort of promote the electric vehicle. The next one, of course, automated. I hope that's a topic not, strange to this audience. I was the TRB committee chair for automated transit systems. This is about 2010, 2011. I was one of the founding group started the automated roadway symposium. And now you see the big growth or big sort of interest. Compared to electric vehicle, I will see this is motivated or promoted by industry, not necessarily by the federal government, which I'll show a little bit more. And again, supply chain issues. I'm sure, now everywhere I go, people say, well, you're the endowed UPS or, a supply chain professor. Tell us how long the supply chain issue going to last. I'll give you a little bit, answer, or at least my professional guesstimate. And this is where you are looking at the behavior change. This is one of the study Shen and a few others did. As you can see, this is where you're looking at before, after, and during, or short-term, long-term. This gave you a little bit, I guess, a glimpse how people make decisions. I guess, Cynthia, we're the behavior specialist, right? We're looking at what are the factors affect travel behavior. This is where you can see the 4 different bars before you may be looking at, well, how convenient this is. How much time can I save? And, the shift when you look at the different bars, a probably little bit sort of self-explanatory. When you look at, say, time savings, before, that's a big thing. We all wanted to get there fast, get there easily. Now, maybe you say, well, maybe not that a big a deal. Maybe I don't have to rush there, but more importantly, I wanted to see how convenient, how safe it is. And this is, I don't know, Chandra is, are you still there? We'll probably have a good discussion about value of time, because as a travel demand forecast, we often look at how people value their time. The prevailing theory is people value time differently. When you are in the vehicle, it's one value, versus if you're outside the vehicle, if you have to walk, especially this weather, it probably attach a lot of penalty when you are outside the vehicle. Now we're actually concerned, well, if I have to share with others in this transit or shared vehicle, maybe I'm actually putting more penalty in the in-vehicle travel type. So this is partly like a future consideration for travel behavior research. And this gave you another sort of indication. Say, well, maybe it is word memory, or maybe not as short as goldfish, but it's not really permanent either. This actually show you for grocery shopping. Before, maybe not a whole lot used. During that, a big, you see the blue bar get extended. But guess what? In the short term and in the long term, we probably go back to pre-pandemic. All the increase is fairly small. I was talking to some foodies. There's like, well, I'd rather go to the grocery store, squeeze a tomato myself. I don't want to just, deliver to me. So with that, this is where during the pandemic, we see a lot of responses on zero fare transit, which of course pre-pandemic, some usage, but during the pandemic, especially in New York City, it's initially like if you're a nurse, if you're a doctor, you have to go to the hospital, you don't need to pay a fare. And some places were trying to release whatever pressure to certain systems, or just during a special period, they actually implemented zero fare. The other thing is, of course, you're trying to get, ease off the peak demand because you're trying to get the distance between different people. And of course, then you're looking at how do you trade off between mobility and safety. This is where what I already started a little bit. I think this is where you're looking at from transportation research perspective. The inequality is probably there always, but during pandemic, it's probably get reviewed or projected or even exaggerated during the process. And the change of perception, both bias. That's where we're looking before maybe say, well, I don't want to ride a bike, or maybe I don't want to take the bus. Now you see, well, maybe that's the only mode, or maybe that's the safest mode. So there's a reshuffling between different modes. And of course, the market shock strategies, that's where you're looking at more through business perspective. The study I did with the aviation manufacturers, generally, if you have a diverse business model, if you have military contract, the business can survive. Otherwise, you might just totally get decimated because if you lose all the aviation manufacturer job or contract. Hillary already gave me the sign. So I'm going to run through really quick in terms policy development. I have listed here. And this is the critical role I'm talking about. It's more like inclusive mode of shared mobility, not just Uber, Lyft, but you're looking at much more. And from the electric, again, you're not just looking at, okay, the charging station or Tesla. There's many other alternative mode. And of course, about automated transportation. The reason I'm putting automated transportation is not just driverless cars, which you probably see, oh, that's 20, 30 years down the road, because I am talking about inclusive automated transit. During the pandemic, you probably haven't heard a whole lot complaint from Paris, right? Because they actually is the first transportation system, they have driverless subways, which is, again, in my book, I have to make a plug. I have a book called Automated Transit, talk about planning, operation, and applications. And even here, we have the West Virginia Morgantown automated people mover for their 50 years. It's been operating safe and very efficient. So with that, I would say you can almost apply the similar approach to freight and other systems. That should conclude my presentation before I get kicked off. All right. Thanks. I got it.
right. Okay. So, Dr. Lu, thank you. That was wonderful and obviously an incredibly important, interesting discussion. I think we could go on for hours. So our next presentation is actually two speakers. So we have Dr. Bahar Dadashova and Dr. Zhao Li, both with the Texas A&M Transportation Institute. Dr. Dadashova is an interdisciplinary research scientist. And her research focuses on linking the built environment and transportation infrastructure with highway safety, mobility, operation, public health outcomes, and equity. And Dr. Lee is an associate transportation researcher with the Mobility Analysis Program, the Texas A&M Transportation Institute, and is also an affiliated Kinder Scholar in the Kinder Institute for Urban Research at Rice University. I will now turn it over to you both.
Hi everyone. Thank you, Hillary. So I think, thank you, Dr. Rachel. I think that was a great presentation and it's gonna tie a lot to what we're going to talk about. So our, today I'm gonna discuss a little about the preliminary findings of our project called Impacts of COVID-Induced Active Transportation on the Built Environment and Public Health. So again, yeah. So as Dr. Rachel mentioned, there has been a significant changes to how people are moving, started moving around. As you know, COVID-19 probably became a little, I would say like a big pandemic because of the transportation, because people could easily travel from one location to another. So that's why I think it made sense that the first thing all the agencies or jurisdiction had to do is limit people's travel, and it affected mostly I think transit and other types of ride hailing, and people had to find a way to find new alternatives, and active transportation became one of the most used modes of travel. Can you hear me well? It's just, okay, great. Mode of travel. So we saw both from the data and also some of the the observations from the field that there were like 200 to 300% changes, increase in active transport use. And but in this project, we were more interested in knowing how all of these changes in travel mode, like moving, shifting from usual modes of travel to active transport modes would impact the health and subsequently equity. So we have a very multidisciplinary approach here. So we had this project. In this project, we're trying to address several objectives. First of all, trying to see how the COVID-19 induced active transport had changed. We just wanted to estimate those changes, and then look at the changes also in built environment, because we know that because of the increasing demand, one of the biggest changes, policy changes, was to the built environment and urban streets. So wanted to assess those impacts as well, and then try to see how all these changes would affect the health outcomes. We call it secondary health outcomes. So here we're not talking about the health in terms of transmission of COVID. No, we're talking about in general how people's the special active transport users' health might have been impacted because of these changes in demand, also in built environment. And we also hope to develop some data-driven tools and recommendations. So here I'm just showing a little bit of yeah, we had to involve geographers, GIS experts, and health experts, and then built environment experts in our project. So basically, we're looking at two interventions. The first one being COVID-19 as a first intervention, and then the second intervention is going to be the built environment, changes to the built environment, change to the active transport as a travel mode, and then changes in air quality. And then we're trying to look at how it impacts the active transport users' health in terms of physical activity, traffic crashes, air pollution related diseases, and we also try to look at the mental health, such as the stress, like want to see how it might have impacted people's stress levels and how people might have started using active transport mode more because of that. And then I will invite my co-PI to present the results from first research question.
All right. Thanks, Bahar. And hi, everyone. This is Xiao Li from TTI as well. In the next couple of minutes, I'm going to briefly introduce the key findings we found from literature review. Actually, just as Bahar and Dr. Liu introduced, since the pandemic began, we saw a lot of changes in our life, right? Like even like today in this room, we still have half of people wearing the mask. But actually the change is not just like wearing a mask. People reduce their mobility, people change their lifestyle. Like some people, they stop using the indoor recreational facilities like going gyms. Instead, they're going out like outdoor activities, trying to use biking or walking. And we also see a decrease for the traffic volume, which also influence the air quality. So all these kind of changes are ongoing. So in this study, we want to know like so we saw a lot of changes. They will direct and indirectly influence the health outcomes of active transportation users. So the question we want to answer here is how these changes, like COVID-induced changes, gonna influence the health outcome of active transportation. Okay, so this figure shows the conceptual framework we proposed in this study. So we majorly examined 3 major changes we observed from the pandemic. One is the built environment, one is the travel demand change, and another one is about air quality. We examined these 3 because we think they are interconnected. Since the pandemic began, like when you walk on the street, you may see some modifications for the roadway. Like we saw some temporary bike lanes. So these changes will accommodate like the increase of biking or like promote the usage of bike or active transportation. So that will influence the volume change. As meanwhile, like with the reduced volume of vehicles, our air quality also changed. So all these 3 changes are interconnected and that kind of impact the health outcome of active transportation users. So during the pandemic, with the reduced frequency of physical activities like walking or biking, it can help you to maintain health, right? But at the meanwhile, walking or biking will expose the active transportation users like to the traffic, like crash or air pollution. So in this study, like we examine the health outcomes through 3 health pathways: physical activity, traffic crashes, and air pollutions. Okay, so in this study, we proposed a mixed literature review method. We combined a scoping review and a narrative review. So since the pandemic began, there are a ton of studies publishing the findings, the changes, but the truth is like currently we still, like most of studies only focus on the changes, like what we observed from the pandemic, but very few focus on the health assessment. So in this study, we first did a systematic review to systematically collect the evidence from published works to see how these 3 aspects changed. And then we did a narrative review to collect the supporting documents, help us to interpret the implications and of these changes to the health for the active transportation users. So now I can report some results we found. Some are very similar to the Dr. Liu's results. So I think that's good. It's a cross validation, but we also find something different. So here, like in this slide, it reports on the change of 3 types of active transportation: biking, walking, and bike sharing. Two types of changes are reported. One is a volume change, another one is a share change. In terms of the walking, actually 50% of the review study said like there's a decrease for the volume of walking. That makes sense because of the like shelter in place, like this order. So people stay at home, not walk out. So we saw a decrease. But the interesting thing is the share of walking actually increased. So the similar thing is like for the biking, the share of the biking also increased. But for the volume, 50% of the studies said like there's an increase in some types of certain types of biking trips, like the recreational trips. And we also saw some papers said like no change, or even have a group of papers said that there's a decrease in biking. But another interesting finding is most of the decreased findings are from the US. Most of the increase are from the Europe, like the European countries. And the last one is about bike sharing. Actually, our finding found like 70% report a decrease in the volume. But this is another thing I really want to mention, like this volume change, actually, it is not a constant a change. It changes very specially, and varies over time. So when at the beginning phase of the pandemic, like when the mobility restrictions implemented, people not go out. So all the traffic volumes are decreased. But with the release of these mobility restrictions, we're gonna see the increase. So it really depends on the location and depends on time you do the review. So this is still an ongoing work. Like we currently cover the first wave of the COVID, but we're gonna extend it to see the long-term changes. The second part is about the air pollutants. So this the existing studies majorly report on 8 major air pollutants relevant to the vehicle emissions, including the BC, black carbon, carbon dioxide, nitrogen dioxide, other nitrogen oxides, ozone, PM10, PM2.5, and sulfur oxides. So among these 8, actually 7 of them are dropped. Like we saw a decrease in 7 of them. The only increase, the one is the ozone, and the study said like ozone is the increase of ozone can be contributed by the decrease of the nitrogen dioxides. So yeah, but overall, the air quality becoming better during the pandemic, which is good for the active transportation users. And another part is about the building environment change. And as I just said, like we saw that a lot of modifications from the city. Some of them are short-term and some of them are long-term. For example, we saw some temporary bike lanes and sidewalks, and we saw some like relocations, road space, like making rooms for the road, like walkers or bikers. And we also saw some cities, they implement traffic calming measures, like reduce the speed limit, and also like set the restricted zones, protect the active transportation users. As a meanwhile, we also see some long-term modifications, like the installation of facilities, like bike storage, or like e-bike charging, or like add some permanent bike lane or sidewalks. So these long-term changes. And also, some cities install the automatic crossing signals, so which can help people reduce the time of pushing the button. And they also expand their public spaces and the green spaces like parks. Yeah. So there are all the changes we found, and then we link them with 3 health pathways. The first health pathway is the physical activities. I don't know like how the COVID impacts each of you, but for me, I never went to gym during the pandemic. So that is, yeah, and I reduced a lot of work, like walking or riding a bicycle, something like that. Like my life was totally changed, and I gained about 20 pounds like last year. So that's the thing, like that's the impacts on me. So, and I think that that's impact everyone. Studies said like reduced physical activities actually is very common for a lot of people, and it is more common in the vulnerable population groups like older people or like poor people, people with lower socioeconomic status. So it is becoming more and more important to recommend people to walk more often or bike during the pandemic, help them to maintain health. And next part is about the air pollution concerns. So it is a very, obvious change. So the air quality becomes better, so we can get more health benefits from walking and biking because we have no concerns to expose to their air pollutants. But the thing is, as we just discussed, like we already see like the mobility restrictions released. We started to see like the more cars on the road, and it's gonna back into the pre-COVID level very soon. So how we can maintain the temporarily reduced air pollution for a long term, that will be another challenge. And another one is about crash. And I think Dr. Liu already introduced. Actually, we see a decrease in the number of crash for sure because of the like less traffic exposure, like the less car, like traffic exposure. But the thing is, we saw more and more fatality and severe injuries, and the share of the bike and the pedestrian crashes actually increased. And another thing we need to highlight is here, like highlight here is the drivers becoming more dangerous. So studies reported that there's an increase in the drug usage and aggressive driving behaviors for the drivers during the pandemic. So maybe it's because there's not that much car on the road, so no congestion, so they drive more aggressively. Another reason, maybe like people like me, I didn't drive for 3 months since the pandemic began. So I almost forget how to drive. So I drive very badly. So that's the thing, like a lot of things may impact your driving behavior, driving skills, and that will in turn impact like the traffic safety, especially for the vulnerable road users, pedestrians, and the bikers. Okay, so the last part is about the policy recommendations. So we found from the literatures, and again, I need to acknowledge it is not a very comprehensive list of recommendations, but I think it can serve as a good starting point to facilitate the discussion about how to promote active transportation in the post-COVID period. Actually, there are 4 types of recommendations. The first part is about the facility. We need more facility. We need better facility for sure. Like we need to install more bike lanes, definitely. And we need to take traffic calming measures for sure. And the second part is about accessibility. Actually, we can interpret accessibility from 2 perspectives. First, accessibility to biking facilities. We need more trails close to the residential area so people can easily access to these facilities. But at the meanwhile, we also need to improve the accessibility of biking and walking. For general, So people, they should be able to reach to more places through biking, through walking. If you, take a trail but leading you to nowhere, so why you take it? So if your bike lanes can link, like the bike lane can link you to all the grocery store, like the convenience store, like medical care, you're gonna use it more often. So the accessibility. So the part is about the policy making. The governments need to take immediate attention because during the COVID, like with the reduced traffic volume and the more need, like increasing need of active transportation, like it's a perfect time to test different interventions to promote active transportation. Last part is about education and the dissemination. So we need to promote the education of biking and promote and disseminate the benefits of biking and walking, helping people to cultivate the habit of biking and walking. Yeah, I will give it to Bahar, and we're gonna finish it soon.
Yeah, we'll just wrap it up. So as Xiao mentioned, in this, we developed framework for evaluating these 3 health outcomes, but then we're also, as I mentioned, interested in mental stress or like just looking at how people's sentiments changed during the COVID. That's the health measure we used for assessing the mental health. So we conducted Twitter, we're still conducting Twitter analysis, just trying to using some certain hashtags to identify the tweets that were tweeted before COVID, early COVID, during COVID, and until now. Hopefully the last one will be post-COVID soon. But those are the like 4 stages we looked at. And just looking at the post-COVID, it seems that the people's sentiments start to become more positive when they are tweeting about the relationship between active transport and the built environment. So those are good news that we also have to look at the previous years. But we will be wrapping up this analysis. And then our third question is going to be about more policy recommendation and how people or policymakers can keep this momentum going. So we plan to conduct a survey looking at the travel behavior, changes to built environment, and finally looking at the health impacts of COVID, secondary health impacts of COVID. And that's where we wrapped up.
Right. Thank you both so very much. Super interesting work. Great. So our next speaker is Cole Kopka, who has served as the Assistant Director of PacTrans Region 10 UTC since 2016 and is also a PhD candidate in the School of Civil and Environmental Engineering at the University of Washington. Cole.
Thank you. I'm all that stands between you and the end of the day. Yes, so I'm Cole, Assistant Director PacTrans, also a PhD candidate, and I will be presenting some work on behalf of several colleagues in my lab. And before I start, I should probably apologize to them in advance, because while they did a lot of great work, I'm probably not going to do it justice. And if you could just lie to them and tell them I did a great job, if we can be a team on that. So if you talk to Dennis Chai or his predecessor, Jiyoung Kui, who worked on this, just tell him I did a fantastic job. Thank you. Okay, it's late in the day, so I figured we'd start with an easy concept, right? So traffic affects everyone's daily life. Can we all be on board with that one? Yeah, perfect. Fantastic. When we think about urban traffic, I could have put a slide up here about hourly traffic. You know the curve, right? So it rises in the morning, it peaks sharply, it troughs for a while midday, it goes back up to a crest for a PM peak, and then it goes back down, right? So we have these pretty, or at least we had these pretty standard normal traffic patterns. And as you've heard from the 2 presentations before me, that all kind of went out the window in March of 2020. And things changed. So we had empty buses, we had empty streets, we had empty rail, empty planes and airports, we had empty lots of things. And so in our lab, we were thinking about ways that we could quantify the effect to traffic. And so, to where we start is how we currently evaluate urban traffic, right? And so that's done by level of service. So many of you will recognize the figure on the left from the highway capacity manual about how you calculate level of service. On the right is actually a data platform that we developed in the STAR lab at the University of Washington called DriveNet. So that's a level of service around the Seattle area for a snapshot in time. But level of service has its kind of its pros and its cons, right? So density is really hard to measure. And it's also incredibly complicated and time consuming to try to do it from an entire network perspective. And so what the 2 gentlemen who I named at the beginning of my presentation did was they basically decided that they wanted to come up with a new metric for evaluating urban traffic that had kind of more robust inputs to it. And so they came up with what they called the traffic performance score. And so this is based on both volume and speed and also length. And basically, I'm not going to go through the math on this because I don't know it that well, but basically what you get is you get a number between 0 and 100. I know Steve convinced all of us that we're not doing exams anymore, but think like a test. You get a score between 0 and 100. So at 0, you get total congestion, and at 100, you get network-wide free flow. So that's basically what they came up with. And so now we'll move into kind of things that we saw using this through the pandemic, right? So let's start with the data that was used. So we get data from Washington State Department of Transportation. They have 44,800 loop detectors on freeways in and around the greater Seattle area. So we have a list there of the 5 or 6 different highways that are included with that data. And so that comes to us in real time. And then it is processed into traffic performance scores. And so the students created this website. It is live. You can go there right now if you'd like. It's tps.uwstarlab.org. And there's a lot of things you can play around with. So on the left there, you'll see the menu bar. So you can do network-based TPS. You can do segment-based TPS. You can look specifically at some impacts of COVID-19. And then there are other travel metrics like VMT, et cetera, et cetera. And then there's also the other thing we wanted to do was some future prediction with this, and I'll get to that a little bit later. So we'll start with kind of what COVID looked like early on. You'll all probably remember something similar to this from where you're from. So in the greater Seattle area, this is basically all March of 2020. So major tech companies basically told their employees to work from home on the 6th, and then UW suspended on-site classes and finals on the 9th. Our governor closed schools and expanded limits on large gatherings on the 13th, shut down restaurants, bars, and again expanded social gathering limits on the 16th. By the 23rd, Governor Inslee announced our stay-at-home, stay healthy order, which was, our basically shelter-in-place order. And then it got extended in April through May. So that's kind of the foundation on which we'll look at the rest of this data. So here we'll just start with some descriptive statistics here, right? So we've got confirmed cases going up through March and April. And then up at the top, it's probably a little hard to distinguish between the blue dotted line, which is the general purpose lanes, the TPS score, and then the green dots, which is the HOV TPS score. But basically what you're seeing is that the HOV lanes freed up to free flow conditions faster than the general purpose lanes did, which is fairly intuitive. And that we really got to a point where in both cases, it was almost entirely free flow conditions by the end of March. So here is again the TPS scores each day, and then we've added all 6 of those kind of milestones that I just described in a previous slide. Again, you can kind of see that TPS score was in the 70s, 80s, up into 90, and then once all of these milestones happened, it pretty quickly skyrocketed almost all the way up to 100% by the time you have that stay-at-home order toward the end of March. Here's another look from daily VMT on weekdays. So we were hovering right around 16 million vehicle miles traveled. And then as these milestones started coming about, we started to see a pretty significant decrease to about 50% by the time that the governor announced the full stay-at-home order. So some other cool stuff you can do with the website. So you can set baselines and you can compare, say, VMT to whatever baseline you set. So for example, if you were interested in looking at the difference between, I'm going to think of an example outside of COVID, but the difference between a rainy Tuesday in May and a not rainy Tuesday in May, you could look at what the TPS score difference is. If you wanted to know the difference between a Seahawks Sunday game day in October versus one where they're playing away, and you wanted to know what the network-wide TPS score was, you could do that. So you can set a baseline and you can compare VMT to that baseline. So there's a lot of ways for you to kind of customize and play around with the website. Here are a few other kind of examples of different baselines. So for example, the one on the right is basically using the baseline of the stay-at-home order, and then watching what the trend with the VMT and the VMT changes based on the baseline are. So got that. And then the last thing I wanted to mention again was the prediction. So part of this was about looking at what happened, and part of this was about whether or not we can predict the future. And so colleagues have used some machine learning algorithms to try to do some prediction. So you can see here that they have the next hour, the next 3 hours, the next 6, and the next 12. And kind of one of our lab's visions for this is, you know, every day you can go and see predictions for weather, right? Well, what if you could go and see what predictions for traffic was going to be like on the network or the segment that you wanted to use? Obviously, the difference is that when you hear it's going to be raining and you bring an umbrella, the weather doesn't change on you because you brought the umbrella. Whereas if we start predicting traffic patterns and people respond to those changes, then it is changing in real time. And so you need to have this real time kind of machine learning algorithm to keep continually updating the way these things work. But so this is still, these algorithms are still being refined. They're pretty well done, but you know, we're one of the issues that we found was that because what we started with was basically COVID times data, it's been really hard to establish kind of a baseline normal because we haven't quite gotten there yet. So that's kind of where this is taking a little bit more time to train it to the accuracy we'd feel most comfortable with. And that's it, short and sweet. Thanks for listening.
All right, so thank you so much to all of our speakers. We can open it up for questions. Any questions we have? None, I have a few. So I think I'll start actually with Cole, since you were just here. So there was, in fact, this actually relates because there's been several conversations or several discussions where we've talked about the increase in the severity of accidents. We've talked about driving behavior, aggressive driving, that kind of thing. And I was wondering, since your data gives us this real-time TPS, did you see any evidence of that?
So we actually, in early presentations of this work, we actually got this question a lot because you hear a lot of times of speeding that is well in excess of anything we experienced pre-pandemic, like two plus times the speed limit driving. Because our data is aggregated, that is not, so we actually, what our data was showing was actually the opposite, that we were not seeing speeding, but I think the difference there is the standard deviation, right? Is that you had these actors who were excessively speeding, but they weren't the vast majority of the people using the network.
Thanks so much. So any questions from the audience? Yeah. Good. Yinhai and then David.
I just want to help to answer that question because this work's done in my lab.
Oh, yes.
Yeah, actually, we collected a lot of data. And when we present this as a webinar to Washington State DOT, they brought up the question because they start to see more fatality on the road. But quite frankly, we did not see evidence that during the pandemic on the freeway, we have increased speeding behavior. Maybe most of this speeding behavior is in the maybe urban streets, not the freeway. So we did not really see any statistically significant result from the speeding perspective.
Oh, yeah, I'll just have to press the button.
I just want to add something on that. Actually, we did a similar study. We examined the speeding ratio, like the percentage of people with a speeding behavior on the rural two-lane highway. Actually, we found like if people have the speeding behavior there, it's a lower, like the traffic crash rate. But it doesn't mean speeding means more safe. Like, but this also maybe can indicate like when people they speed, like or they're speeding, like have the speeding behaviors on the roadway, maybe they feel safe there. So they can drive above the speed limit a little bit. But it also is the question related how we quantify speeding. If the speed over the speed limit that's speeding, or it needs to over a percentage, that is speeding. Like how we link the severe speeding behavior with the crash rate. I think that's another thing we need to examine in the future. Yeah.
Great. Thank you guys so much.
David Kack, Montana State University. And for the first two presenters is we're talking about more active transportation and the e-scooters. In that, as we talked about in the previous session about, you know, is it a generational thing? So do we see mode shift more because the younger generation isn't saying mobility is tied to owning and operating a car, that there's other modes that get me to where I want to go? So is it somewhat a generational thing, or did we see more uses of biking in those modes in all age groups, or was it more focused on the younger generation?
No, I don't think we're able to look at the ages. Like we cannot really, because the field data that we are looking at doesn't really collect that information. We're just like looking at echo tubes and even with the crowdsourced data. But I would say like my speculation on that is that I think like older generation, they had more accessibility. You know, I mean, they had that privilege of being able to work from home. So I would agree that it was probably younger generation that they did not have that privilege, like they had to go to work still. So those are the people that might have increased that you know, active transport use. So, but I agree.
I would say yes, because this is where, you know, we have looked at some data. Some of you may heard Department of Energy. They have a lab. They done some study. This is actually before pandemic. You can, I don't have the specific numbers, but you can see this is online. The survey actually clearly indicate the generation gap. You're looking at, you know, my kids are millennial or whatever. The first thing they go to some place, they get on the phone, Uber, right? Lyft. And this is where also you look at this generation, they may or may not wanted a car. And that's in the data. I actually say, you know, when the kids 10, 16, 17, different stage, how eager they wanted to get the driver license. Look around the room, I'm sure a lot of you can really, oh, we can't wait. We just, my case wasn't. I have to push him the day before he go to college. I took him to the driver's license test, right? So the other thing is not only just generation, but also education levels, career, and geography. This I have a personal experience. In New Jersey, I can easily, you know, get an Uber and whatever. Washington, especially if you talk to this Congress staffers, that's a hip thing. You don't own a car, you actually get Uber every day. And same thing in New York City. When I moved to North Carolina, first thing I asked, like, which app should I download? They said, no, don't download, because one, you can't really get, you know, like a rides pretty regularly. Two, our university actually doesn't encourage you, you know, Uber, Lyft, or especially Airbnb for travel. So there's a pretty generic pattern. And for the bike, especially the data I show coming from City Bike, which is pretty big, Washington, DC, and New York City. Thanks.
I just want to, just one more point I want to add to that is about, I think all these new technologies are not very friendly to the old people. For example, you want to use a shared bike, you need to use a phone, right? Scan the QR code. And you need to use the app to bind with your credit card. And the same thing for the Ubers. So like once we use this kind of shared technologies or new technologies, we use the phone and change from app to app to app. So that's set barriers for the older generations using them. So that's another thing we need to think about, how to make this technology accessible to these people. Yeah.
Great, thank you all. I also wanted to put a point for any of our Zoom participants. Feel free to put your questions into the chat and I'll make sure to get them to our panelists. Any additional questions from the audience? Yes, Lisa Kay.
Hi, my name is Lisa Kay. I'm with Carnegie Mellon University. And I was curious, as you were talking about sort of looking at the age difference, was there any look at people with disabilities and whether their patterns changed as well?
That's a very good question, actually. I have no answer at this moment because what we do currently is the systematic literature review. So we start searching all the publications we found, but we narrow down to the 3 changes we found. So I assume that is, I surely believe first, that is a very like a noteworthy question to explore. And our research definitely need to cover that topic as well. But I do think, like, as I reported, like for the vulnerable populations, like older people, like their usage of biking, all this kind of active transportation modes is really reduced mostly compared to other generations. And also the socially vulnerable people, like in low socioeconomic levels. And another thing, like Bahar just mentioned, actually, there's another article I read. It's like said, like staying at home is a privilege. It's not only for the older people, actually it's for the rich people. The work they do for the IT, for some things, they don't need to work, like to go to their company, they work from home. They have more time, stay at home, maintain their house, going out. But for the essential workers, like they have to take the risk, maybe take the public transportation, go to their workplace and serve the society. So they have no, like less opportunity to really like care about their like health, discuss health concerns because they care more about their income. So that's the same like inequity issue that we need to think about, or when we really examine the impacts of the pandemic, the equity issue is another issue we need to look into. Thank you.
Stan.
Hi, Stan Caldwell with Carnegie Mellon. We were working with our State Department of Transportation in Pennsylvania, throughout the pandemic as well. And their question throughout the process was, should this change our investments in transportation? So whether it's a city transportation department or a state transportation department, were you able to kind of advise, and then what were those, those recommendations on should infrastructure or service or, investments change over time because of what we learned from the pandemic?
Question, Stan. Who wants to start with
Yeah,
that?
that's a good question. Actually, that's how we started our project. We wanted to, I think that was the question that was asked by the MPOs, because they were interested in knowing those changes that they made to the environment. Was it enough to curb the demand, or should they continue doing so? I hope that's the policy recommendation we can come up to as the result of this project. But that's what we've been seeing so far, that that the changes to the environment have been used by people, and like a lot of people want to keep those changes, and like sharing the streets with the vehicles, and building, allocating road to the active transport users.
Maybe I can add that as well, because some papers that said once the city start making changes, people make changes as well. Once we have more bike lanes on the road, and there will be more bikers, maybe more or less, but we can see the increase. I think this question is about the policymakers, how they want the community to be. Do they really want to promote active transportation in their society? Because what I think is the facilities the part. Another part is the dissemination, education. Do you really, does people they really want to walk, or should we promote them and encourage them to walk around? This is another funny thing I want to share. Yesterday, Like when the snow stopped, I think it's very beautiful here. I really like this resort. So after dinner, I walk around with Bahar, and we are the only two people who work here, at least at the moment I saw. I think this is a very walkable community. And that is with beautiful, nice view, but we didn't see people walk. That's another thing that once we think about the facilities, maybe some other changes we also need to make, how to encourage people really get involved into active transportation. And maybe we can start with like providing free courses, like teaches people how to do the education. We need a better planning, like the bike lanes, the routes, they are really can help, like can bring convenience to people. Like when you bike, you can go to anywhere you want in the city. But actually the truth is in Texas, like the city where I live now, if you bike, it's only biking. Like for the recreational trips, you cannot bike to the grocery store to walk or something. It's not convenient. And it is not safe. Once they no people on the road, only you bike, it feels very creepy and scary. So all these things will impact people's perception, choice of active transportation. So I think that is a very complicated question because it needs not just the transportation issue, it's also about the urban planning and the social issues. But again, what I want to express is it's really about the decision makers. What do they really want to see the city to be in the future? Do they really want to open the arms to embrace active transportation for this city? That's the question we need to think about before we're making any actions. Yeah.
Great. I actually want to take San's question and specifically ask Cole Yinhai, when you think about the work that you've done with the TPS and what you've learned through the COVID, how do you see that work moving forward in the future, addressing some of these policy issues, that kind of thing?
Well, so interestingly, our presentation was on vehicular traffic. I actually spend most of my time doing research on more of what we heard from the rest of the table.
Mhm.
So I'm going to go a little bit off script, and then I will give you a chance to respond as well. In Seattle, we had alfresco dining, we had residential streets closed to cars, because we saw such a decrease in vehicular traffic, people all of a sudden realized that the right of way doesn't have to be completely given to the personal automobile. And in many ways, we've come out of the pandemic, at least the way we're acting. And a lot of those residential streets are still close to cars, and a lot of the places where they built structures for outdoor dining still exist. And so I think in some ways, and I very much agree with the last comment, I think in some ways, the DOTs need to decide what their priorities are and make decisions based on that. But I think a lot of people's perspectives were kind of shaken up, and they might now have a new perspective on the role of the right of way just because of the way things have changed over the last 2 years.
Yinhai, did you want to add in? Tracy, can you grab? Yeah.
I think I'm the next one.
No, you comment. He was just gonna comment. Sorry.
That's a very good question. Actually, when we started to consider doing this research, we were thinking about we actually need some kind of a performance measure to really reflect the performance of our roadway. And as a regular commuter or traveler, we also want to know how is the road look like tomorrow, right? So can we predict the roadway performance more or less like predicting the weather tomorrow? Let's say if tomorrow is Tuesday, tomorrow actually is Wednesday, and there may be, for example, Husky game playing at the University of Washington, and it's going to rain. Given all these factors, how our roadway is going to look like. So this tool is developed, try to answer these questions. You can select, I care about, I-5, the downtown portion, how the traffic perform. We build the machine learning, try to integrate a lot of variables like construction schedule, schools activities, special events, and then we can learn from the past experience and maybe to predict for tomorrow. As Cole mentioned, people learn and they look at your system and they adjust their behavior, right? This adds more difficulty on predicting this more accurately. But so far, the machine learning model has been doing pretty well. And after we have this kind of performance, archive all the data into the system, we would learn, let's say, if there is a severe crash, block a particular corridor, transit service suspended, and how do we see the alternative routes look like from the traffic performance perspective? When we accumulate enough data, we could certainly use this to support, policy making decision on the traffic operations. So this will take time, but at least this work gets started. This work is taken by the TRB AI committee, try to build a benchmark AI platform. So we got all the data contributed there so people can try different models. Let's say when we publish a paper talking about how great my model is, but they're using different data set and different data cannot be directly comparable, right? So we want to put the same data set there. If you claim your model is great, use this data and demonstrate that. So this prototype system is done. We plan to release this maybe during the next TRB, and hopefully researchers can contribute data, make this work more supported by data, more people get involved because this is an open platform. And then hopefully we can see a functioning system that will benefit traveler, decision maker, researcher, and the policy makers. Thank you.
Thanks. Is another question in the audience?
Sure, yeah. I'm Chisen Pan from UT Arlington. When we look at the long-term impact of COVID, we may not just focus on the transportation system performance. We should look more broad impact, especially the relocation of a job, relocation of a resident, the change of a land use, and change of urban form because of the interrelationship between the land use and transportation. I just wonder if any of you look at that broad impact beyond the transportation system itself.
Great question. I wonder, Dr. Lee, do you want to start us off on that?
Yes, this is something I wanted to say when Stan raised the question, but I figure I used so much time, so try to set up.
Please, now's our time for the discussion.
Thank you. I believe so. When you look around, I'm sure there's many planners in this room. When we talk about transportation, especially active transportation, right? If you ride a bike as a transportation mode, you need to go from place to place, from A to B, rather than recreational. Looking at our roadway system or our infrastructure, you don't really find a regular safe bike lanes. And even walking, if you walk in certain neighborhood, a lot of sidewalks can just end somewhere, or it just broken, it can't really continue. One of the cities in New Jersey actually was talking to me, we're trying to get this crowdsourcing, we actually create this platform, have you send pictures and say, hey, this is broken sidewalk, we can passing through safely and whatever. Of course, the other is brand new issue. I don't think we have a solution. It's really land use. When we had the zoning very much separate your working and your residential places, it's great for your environment or residential quality life, but there are certain issues associated with that. So hopefully COVID maybe create this opportunity, right? And that's actually part of the reason I jump on this opportunity to do this presentation, because I feel the UTC or CUTC is a really great catalyst, because, hey, you're not a consultant, you're not DOT, you don't have to go through, this is your task, but you are the researcher, or we are advisor or gave suggestions. This is where our research result could make some difference.
Thank you. So I actually have one final question. I know that we are standing between all of you and an awesome banquet tonight. But most of our conversation today has focused on people, active transportation, human mobility. But Rachel, in your presentation, you also talked about changes in freight and supply chain and intermodal rail. And I'm wondering if you can talk about what you see as kind of the long-term impacts of COVID on supply chain, freight movement, that kind of thing.
Okay, I'll try to be brave. I know I'm between, you and the dinner. I think one, in the short run, this is probably bad news, right? I'll give you the bad news first. If you look at the supply chain, I would say it's going to be for a while. Because there's some point, yes, there's COVID. Yes, there's some, blockage. You look at China, there's zero tolerance policy, which is really policy all human made because some ports just literally shut down. It's not a product, they're ready, they're in the warehouse, but they cannot get loaded. And some are our policy here. I actually have one of the slides. I didn't get a chance to talk. How many of you know what a CUTC is? Yeah, right. It's nobody paying attention. We heard, you probably learned in the class, but who cares? It's just that little frame. If you look on the road, every truck has a container. There's this metal frame. You have to put the container on top of it. Just a couple months ago, I took my student to one of the sites, the brand new intermodal facility in North Carolina. It turned out the biggest bottleneck is actually not containers. We know there's container shortage last year, especially, but China can react really quick. They send the containers, but we have CUTC shortage. Why? Because this is Trump era policy. Somehow when we put this sort of, tariff or, curtain, whatever, we said, you cannot import CUTC from China, which is not high tech at all, just a little metal frame with wheels, but you need to lock the container on top. Somehow during that policy process, somebody made the suggestion we should stop, China from importing those. And guess what? We don't have CUTC. You can have containers, you can have ships, but without that thing, you can't really move to your last destination. So that's just a little example, many sort of glitches like that. But in the long run, those you know me already probably can tell, very optimistic. The great thing is you already see some of the changes. To me, the long-term change is really lifestyle. When you look at, American or Europe or Asia, different lifestyle, different consumption. We already seen the change. And the other thing is people talk about anti or whatever that term is, against globalization. I would say no, you're actually looking at probably a comprehensive or complete supply chain. That's where you should build into a fail-safe option. So that's where you're looking at what are the options or alternatives when something may not be COVID again, but something else gave a shock to the system.
Great, thank you. And thank you. Huge round of applause for our panelists.